So for our group, we chose to cover sober living environments or SLEs and family involvement. So with that, what are SLEs? They are pretty much living spaces or environments in which a client can live in a substance-free housing, and it kind of serves as like a transitional environment, bridging treatment and community living together. And since addiction, it just has this like characteristic of being isolating. So these types of housing kind of serve as like a way to just bring in that relational support along with like the stable housing for like the best outcome. There are also environments where there's like some kind of like structure. It provides like accountability, stability for the client, and this type of environment just reduces like possible stressors or triggers that would just generally end in like more of that risk of relapse. And then also they would allow clinicians to tailor or maybe alter their interventions or their treatment plans to reduce that risk of relapse in the client as well. Um, these types of environments, they tend to be guided by like something called the socio ecological model, and it's or the social ecological model, and then that states that there's this type of interplay between individuals and their social environments. And with this, like for example, if the environment is more stable and families can also provide that relational support, then recovery or the rate in which recovery happens would be at a higher rate. So there are the gender specific or demographic specific, and these kind of serve, populations like women, children, veterans, LGBTQ residents. There are ones that, for example, like those specific, the youth and adolescent, just pretty much like serve that type of population. There's also clinically supervised where there's like where medical and health care is generally involved, or if it's like necessary to that degree. Um, there's also, and this is a little bit more common, the peer supported type, which means that it can involve peer support specialists or like working in mental health, or um, it would have this like enhanced relational like framework that the SLE would operate in. So regarding the prevalence, according to Jones et al., so there's like the women's likelihood of using drugs, for example, is kind of raised by 30%. Um, and for like each additional parent or grandparent who's ever used drugs, that also would kind of like raise the likelihood. Also, if there's any like parental incarceration, that's also linked to later drug use. There's approximately 46 million Americans, 12 plus, that meet the criteria of a substance use disorder, and that is through like SAMHSA. I think like around 10% only kind of receive treatment, which is like a very small percentage of that population. And there's also research to suggest that for youth around 6.4 million under the age of 26, they actually meet that diagnostic criteria for a substance use disorder. And around for that population, like 8 to 12% have engaged in some kind of like opiate misuse, and that usually like leads them to end up like developing an opioid use disorder. So for the impact, so addiction tends to kind of disrupt communication, trust, and routines within like the family. Um, and with that, families frequently experience burnout. There's like stress, there's depression, and there's this constant like feeling of like or sense of like being on edge and like other family members with this addiction that is experiencing it pretty much like affects like everybody in the family, because there tends to be this added responsibility on family members just to care for that individual. And then there's evidence to suggest that substance use disorder through either like epigenetics or Bowen's transgenerational transmission process can actually trickle down to more recent generations. And then that and the added relational stress at home can increase the risk of relapse for someone already struggling with a substance use disorder. Um, and then lastly, regarding recovery, so one of the characteristics is it kind of reshapes roles, responsibilities, and just even alters the family's like homeostasis a bit. So generally, when like somebody is in recovery and like starts like healing and or starts a recovery process, like the whole family pretty much has to adjust. So members would need to, let's say, take on new roles, like let go of old habits, and then just really learn to relate to each other in healthier ways, even if it's kind of messy at first. So, how is this like relevant to the field of marriage and family therapy? So, we can say, when looking at it through the systemic lens, I think SLEs, they kind of show both like relational support, and the environment can pretty much like work together for the best outcome. And that has been shown to be effective for addiction. They can also help MFTs or mental health clinicians to design interventions or treatment plans to address any specific relational patterns that come up. Um, and then there is that added benefit of like involving family or having that family collaboration if possible. And that would allow for more emotional support and that would push toward like or reinforce recovery behavior. And then lastly, just knowing the operations within these SLEs, so like clinicians could just potentially do some type of like cross-functional collaboration. That would be around like that. That would work like in with like SLEs, then maybe like outpatient programs, and that would ensure that the environment for recovery is just more consistent and supportive.
Okay. So some of the literature review we did, just on this particular slide, um, we kind of picked a few good points from each, from just a few articles. So family involvement is a key predictor of better treatment outcomes for transition age youth with substance use disorder, including higher retention and reduced relapse. Engaging families improves communication support and motivation, all of which strength youth recovery trajectories and family-based treatment models work, but are rarely implemented in real-world practice, and many families lack guidance. Um, the transition age is when youth 16 to 25 are vulnerable, with higher relapse rates and weaker engagement in treatment compared to age groups. This just kind of illustrates, this particular article just kind of illustrates that we need to make sure that in these environments that we are connecting with the families to make sure that they are involved in some sort of program while their loved one is also working in recovery. In another article that we had, women's substance abuse is heavily shaped by family history and social normalization of drug use. Parental and familial substance use increases the likelihood of women developing substance use disorders. Romantic relationships. Being with a partner who uses drugs makes it harder for women to stay clean. Breaking away from these relationships usually helps recovery. Women who've experienced abuse and trauma are more likely to struggle with addiction. Um, so again, kind of making sure that we are looking at not only just the specific, like the small micro of the family unit, but also looking much further to make sure that we're hitting those points of history to make sure that we are um, doing the best care possible. Um, as far as specifically for substance use, for um, sober living environments. Having rules, accountability, peer support, and social networks in the house helps residents stay on track, but successful recovery depends both on the house's peer support and the neighborhood context. Location matters. Being close to treatment and self-help groups helps residents recover, while nearby outlets increase relapse risk. Cost reflects the neighborhood. Lower cost houses are about 600 a month, lower than 600 a month versus higher cost houses, which are more than about 600 a month. So kind of going back to what Kat was referring to, one of the reasons as to why it is so small for people with substance use disorders tend to not be able to go to sober living environments is because of the cost. Um, that also makes it really important to make sure that we're getting the family involved because of depending on where the location is, the sober living is, whether they're getting these large or small peer support networks. We want to make sure that the family is also well informed while the loved one is in the sober living environments. Um, the way that the sober living environments um, help they help improve outcomes. So giving and receiving help in sober living houses, 12-step meetings, and with family and friends improves alcohol and mental health outcomes. Environment of the house matters, and also personality plays a role. Those who are open, conscious, and extroverted are more likely to give and receive help, while traits like neuroticism and agreeableness didn't make much of a difference and how much they've helped others. This just kind of reflects on how ready people are when they're going into these sober living environments. If they are more willing to seek help and try to begin the process, um, it kind of helps them go a little bit further versus because they were incarcerated because families pushing them to go, it'll be a little bit more difficult for them to buy into the program and also the family being more apprehensive in being involved in their care while they're there. Um, so, some other key findings and theoretical frameworks. So the SLEs are based on the social ecological model. Um, so both the environment and the relational piece supports work to enhance recovery. Family dynamics in the sober living environments also have a potential to improve the rate of relapse and also allow for emotional stability. Family therapy engagement reduces youth relapse rates and improves communication. Um, Also, gender-specific and culturally tailored SLEs enhance outcomes for women, youth, veterans, and LGBTQ individuals. That just goes to show that, again, when we're looking at a bit of the social ecological model, we want to make sure that the sober living environments, as much as possible, um, can fit with the population that we're serving, just to make sure that we are being able to grow those peer support models while they're there. Also makes getting the family connected with these sober living environments much more easy. Because if their family members having an easier time, then they'll be having an easier time and have more of the brain space to work on the piece that they would need in order for once their family member leaves, um, they'll be able to serve them a bit more. Um, some of the frameworks that we found that SLEs are more based on, or the things that they use, are the social ecological model, the family systems theory, social network theory, social learning theory, mutual aid and peer support models, and also CRAFT, which stands for Community Reinforcement and Family Training, or Family Skills Training. Um, just to make sure, again, that's one of the biggest pieces in this, is to make sure that we um, give the family skills and not just leave the family to pick up their loved one and then go right back to where they were before. Okay. Um, also, um, I hope I'm not moving too fast for this. Next slide. Um, So the evidence-based approaches and techniques. Some of the evidence-based approaches that we found that some sober living environments use are narrative therapy, family systems therapy, such as Bowen or structural, family psychoeducation, which is a really big piece, CBT, which is cognitive behavioral therapy, and also trauma-focused cognitive behavioral therapy, which is the TFCBT piece. Okay. So, one of the big articles that we also found connected a little bit more to kind of how substance use disorders impact families specifically. Other than kind of a few of the pieces that we highlighted as far as increased depression rates, anxiety, and those pieces, we also found that in this article, um, the substance use disorder with those things also impacts brain function. So those stresses and things like that impact the prefrontal cortex, which is responsible for executive functions like problem solving skills and higher level cognitive processes. Um, and some of those parts in the article specifically targeted parts of the prefrontal cortex, which are the dorsolateral, which works on things like working memory and decision making, and also the dorsal medial, which is in charge of relationship oriented processing and moral judgment. Um, so one of the um, experiments that this article was based on was seeing that when people were shown family images of their loved ones with the substance use disorder, that parts of the prefrontal cortex were more active, um, showing that that family member's brain was more active um, in terms of like the way that that family member has been impacted with substance use, the way that they've been impacted because of the family member substance use. Um, it was also found that there were lower activation of the dorsal medial part of the prefrontal cortex when seeing these same images, which is meaning that because of this continued stress, there's a lower activation of that part, which again is connected to oriented processing and moral judgment, which will make it a bit tougher and as far as making decisions um, for the well-being of the family member impacted by the substance use. Um, and all of these things to say that it seemed to connect with higher levels of rumination and preoccupation. Um, of their family members and also altered decision making and in emotionally charged situations. So again, not having that lower activation of that part of the prefrontal cortex um, does affect those decisions that are being made, which is not helpful for the family members as much as it is not helpful for the family member affected by the disorder. Um, next. Um, so again, um, the people who wrote this article um, tried to redo the and they have found and they were able to find similar findings, um, similar to seeing that there's an activation of a certain part of the brain that was showing that is in charge of processing distinction between self and others, relationship processing, and responding to social situations. Um, so, in that regard, seeing that part light up, um, they hypothesized that maybe improving this part of the brain could support doing things like not developing codependency with the substance use disorder family member and also help improve family functioning. Because again, this specific part in the prefrontal cortex um, was also part of that decision making piece. Um, so not only that, there was a um, yes. So again, all this to say that we want to demonstrate that again, not only is it shown outwards as far as how much that family members are impacted by substance use, but also on a internal physical level as far as how family members are impacted as well.
I will go over the crucial impact that the family plays in SLEs with the role of the family in treatment. And I'm also going to go over some of the challenges and barriers. So, first off, the role of the family in treatment, to be open to learning about what addiction and substance use disorder is and how to remain supportive. There are a few things that go along with that in regards to SLEs, new parent programs, um, visitation, the role of recovery education, as well as communication workshops are also crucial um, in as far as the in the role of the family in treatment. Also, to be open to receiving personal support and treatment. Psychotherapy goes a long way. So the role of a therapist is crucial. The implementation of sober meeting programs such as Al-Anon and Nar-Anon are also crucial as well in regards to sober living environments. Continuing to be present in treatment planning is crucial, especially those with substance use disorder and the goals for family after discharge. Family therapy is one that's very crucial. Adopting a new dynamic. We also want to help those with substance use disorder to reduce stigma. And what we also want to highlight here definitely is the role in which, sorry about that, that family recovery is just as important and the individual's recovery as well. Going on to challenges and barriers. So the three concluding slides are we're going to cover challenges that occur with or within sober living environments, the barriers to family involvement, as well as cultural considerations and implications as well. So going on to this slide, the challenges with sober living environments, we have peer conflicts, inconsistent enforcement of rules within SLEs, and limited staffing may reduce effectiveness, according to Polson and Henderson article published in 2023. Balancing family involvement or external life events slash circumstances. What also plays heavily with the challenges of sober living environments is location. So the potential of limited availability of SLEs, socioeconomically, spots or the chances of wait lists occur as well. That's also crucial with the challenges with SLEs. Population-specific gaps, for example, youth, adolescent, and veteran sober living environments are limited. And that was according to the Hogue et al. Article published in 2021. Going on to the next slide, the barriers to family involvement, potential for stigma or mistrust of services. For example, the fear of legal implications, uh, the child welfare or family or community consequences. Um, so we're, dealing with uh, abuse and things like that. Distance, work schedules, the strained relationships often involved, or lack of resources with limited involvement. Um, the client's hesitation to disclose personal information is also a barrier that's crucial with the relation to SLEs and to their family. So the instances of family conflict, intimate partner influence, uh, was speaking on a lot of this in previous slides as well. Dysfunction or abuse. Um, Existing medical issues are a concern as well, and low motivation or resistance to family involvement, the preference for autonomy. And to round out the presentation today, we have some cultural considerations and the implications involved with sober living environments. So we'll start off with the structure may not match family or cultural values or preferred communication styles. So, substance use disorder knows no discrimination as far as, socioeconomic status, people's background. It affects a lot of populations. So, there are gender differences in styles of treatment, i.e., many women benefit from tailored interventions. Um, Also, women face unique biological, psychological, and social issues, which can all impact their treatment outcomes. We also have to think about the high costs. So, families that come from low socioeconomic status, um, those of low income may have limited access to sober living environments as well, or resources to participate in SLE environments, in family inclusive programs, and adapt approaches for diverse families, including LGBTQ plus community in their households, non-traditional relational support systems, as well as non-English speaking families.